This is regarding ketamine. Does ketamine increases really the intracranial pressure, or it's a story which is coming out from 1970s? Have you ever thought of it that is there a study where they have measured the ketamine's intracranial pressure rise relations while bolus or intramuscular or doses, I mean even intravascular doses? What I'm going to say now is probably it's going to be a surprising stuff for many of you, that ketamine does not increase ICP in most of the recent studies. So what is happening? So although these studies are there from ICU, those patients, those who are having intracranial bolt, the intraparenchymal catheter for pressure monitoring, they underwent all these escalating doses of 1.5 to 5 milligram doses of ketamine. And there is a meta-analysis involving 10 studies. I think it is Cobain et al. In 2014. 5 were RCTs and 5 studies among them were prospective studies. So the results, what I'm going to tell you, is amazing. Now, out of those 5 studies, they did not find any mortality comparison to etomidate or ketamine, any mortality difference or morbidity difference or length of stay difference. And now the more surprising fact, the escalating doses of ketamine, 1.5 milligram bolus with ketamine bolus, then 3 or 5 milligram bolus, did not cause rise in 2 studies any intracranial pressure which is meaningful. Now, 2 more studies has clinically insignificant rise of intracranial pressure, and 2 studies had decreased intracranial pressure. So think about it: no mortality difference, no ICP they have found in all these ICU patients. I'm not saying you go tomorrow and start giving all head injury patient ketamine. It is better to look into the literature and recent past and coming future. So what you will have is that a strong idea. Probably this is the only induction agent which has rise in SVR and maintaining blood pressure. Right now, probably the head injury patient has the worst head injury patient has the worst outcome if they go into hypotension, right? So this is the only induction agent probably would have a mortality benefit of if it is not causing ICP, which was the worry. So based on anecdote, 1970 studies, case report and case series, we still believe that ketamine causes ICP rise. Probably it is not true. So 2 of the studies has been attached to my the thread in that website. Please go through it and let's see what you think. Thank you.